this lecture, we are going to be reviewing acceleration behavior therapy, antecedents that elicit behaviors. But first, we will explore therapy procedures that elicit or initiate target behaviors through antecedent control, and then turn to therapy procedures that change the reinforcing consequences of target behaviors. Now, in a prior video lecture, we learned all about antecedents in the ABC model. And in case you forgot, antecedents are events that occur or are present before the person performs the behavior. So in the ABC model, the A is for antecedents, the B is for behavior, and C for consequences. So antecedents are events that occur or are present before the person performs the behavior, which is B. And C, consequences are events that occur after and as a result of the behavior. Antecedents in itself set the stage for behaviors to occur. In some cases, a client may not be performing a desirable behavior because there are no antecedents that elicit it. For such acceleration target behaviors, stimulus control procedures introduce antecedents to initiate the desirable behavior. In other cases, existing antecedents elicit an undesirable behavior. For such deceleration target behaviors, stimulus control procedures change the antecedents. These interventions involve either prompts or setting events, the two broad categories of stimulus control. Now let's dive into prompting. Imagine this. Driving down the road, you see a sign for the street you're looking for and you slow down. Your friend sitting next to you tells you to turn left onto the street. You change lanes and turn left because you have been prompted to do so by the street sign and your friend's instructions. Prompting provides people with cues, which are the prompts, that remind or instruct them to perform a behavior or indicate that it is appropriate to perform a behavior. Every day we rely on prompts to guide our behaviors, such as when we stop at a red light or check our appointment book. There are 4 types of prompts: verbal, environmental, physical, and behavioral, each of which can be used alone or in combination with other types of prompts. Now, when I am explaining these different types of prompts, I want you to think about a particular person. It could be your partner or spouse or child or whomever. Verbal prompts involve telling clients or your partner what they are expected to do. For example, adolescents with moderate to severe intellectual disability, for example, with IQ scores ranging from 20 to 55, who were students in a community-based vocational training program, were given a series of verbal prompts through an MP3 player to remain on task. This intervention worked as effectively as or better than reinforcement for on-task behaviors. In an unusual application of prompting, children were taught to prompt their teacher to praise the teacher's appropriate behaviors. For example, children would approach the teacher with a completed assignment and say, "I finished all my math problems," to remind the teacher to praise them. Behavior therapists often use verbal prompts together with modeling and reinforcement. By the way, we'll be talking about reinforcement strategies to shape behavior in my next lecture. However, verbal prompts can also be effective on their own in such diverse application as increasing your date nights per month with your significant other. Now, environmental prompts are cues in the environment, such as signs that remind clients to perform behaviors. Some examples are alarms to remind older adults to take their medication, written cue cards to prompt adults with mild disabilities to perform home maintenance tasks, pictorial signs to remind children with autistic disorder to perform daily living skills such as getting dressed, and written notes for people with diabetes to remind them to monitor their blood glucose levels. With physical prompts, also called physical guidance, a client is physically directed to perform a behavior. An example is teaching a child to write by holding the child's hand and helping the child make the required movements. Physical prompts are used extensively to teach self-care skills to individuals with developmental disabilities, such as training children who are both deaf and blind in self-feeding skills. With behavioral prompts, one behavior cues another. For example, a husband in marital therapy learned to use his wife's crying as a signal to respond with sympathy rather than annoyance. An individual's own behavior can serve as a prompt to engage in another behavior, as when parents use their feeling angry at a child as a cue to leave the room to cool off. Now, guidelines for administering prompts include the following. Administer the prompt just before it is appropriate to perform the target behavior. Make the prompt salient so that the client is aware of it. Make the prompt specific and unambiguous. Have the prompt remind clients about the consequences of engaging in the desired behavior, such as reading a sign saying, "Taking your medications will make you feel better." And next, follow-up prompts with reinforcement for engaging in the prompted behavior. Prompting usually is a temporary measure, as the client performs the behavior more frequently because it is reinforced. Prompts become less necessary and are gradually withdrawn, a process called fading. Prompting is a standard procedure for eliciting behaviors that a client rarely performs. So I've got a little test for you. Grab a pen and paper and let's get started. In your interpersonal relationship with your spouse, boyfriend, girlfriend, whomever, name a desirable behavior that you want them to do. Remember, there are 4 types of prompts, so let's work together. There are verbal prompts, environmental prompts, physical prompts, and behavioral prompts. So why don't you tell me, what type of verbal prompts would you use with your partner to try to shape their behavior to get them to do what you want? Now, what are some environmental prompts? What about physical prompts? And then behavioral prompts. Why don't you leave me a message telling me what type of prompts you would use to elicit behaviors in your partner?